Hello and welcome to another episode of Discover with Spinati. We are talking about implants again. Yes, we are talking about implants, but this time we're going to be talking about why do implants fail. And here, the reason why we're talking about why implants fail is because it's very important to realize that if you are a good candidate, how can the implant that you just got placed inside your bone, or even if you have implants that have been there for a while, how can they actually fail? What can you do to prevent them? Now, this here, as you can see right here, let's see if I can, there we go. This is a beautiful implant. Now, this goes inside the bone, and obviously then you get a crown on top, and it looks really good. Now, how did it fail? If you go to Google, trusty Google, if you go to Google and you type failed implants, what you see, my friends, are several images. I'm going to go through that because I want you to see what failed implants look like, because maybe you don't know what it means. I don't know. Maybe you don't know. Maybe that's why you're watching this and you're wondering to yourself, oh, what does a failed implant look like? Well, a failed implant looks like this. So if you start to see these threads, so there is a standard with regards to how many threads can be seen before we can label an implant to be failed. So some say 3, some say, whatever number it is. But if you start to lose bone around the implant and it progressively gets worse and worse, then the implant is going to fail. And the ultimate failure of the implant is it coming out of your jaw. So if you look here, for instance, you'll see peri-implantitis. Okay, this here is peri-implantitis. This is peri-implantitis. Peri-implantitis just means infection around the implant. This is peri-implantitis. You can see here how you have inflammation around the actual implant. You can see here, this is a cartoon image of. So when you start seeing something like this, then you have to wonder whether or not the implant is failing or whether it was placed like this. If it was placed like this, it doesn't mean that it's failing. If it was placed like this, just simply means that there wasn't enough bone tissue for it to support that part of the implant. And so, that bone receded, but it doesn't mean that it's actually going to go away. So it doesn't actually mean this is a failure. This just means aesthetically it's a failure, but it's not a failure in terms of the structure of the implant. So how does that happen? How does the implant get to the point where it comes out of your jaw? There are several reasons. The biggest reason, the biggest by far, okay, around 40%. Okay, the stats show between 30 to 40% of implants fail because of nothing else. Let me put my face here for emphasis. Implants fail for nothing else, or the biggest reason is poor oral hygiene. If you don't take care of the implant properly and you don't allow it to actually be healthy, then you are setting yourself up to fail. That's literally it. So there are two things that are required for you to ensure that that doesn't happen from a poor oral hygiene perspective. One is proper home care, which is brushing, flossing, and also using a water pick. Highly recommend you use a water pick. Now, the second is for you to go in for a dental cleaning every 3 months. If you have a dental implant, you're committed to make sure that that part of your mouth, especially that part, is clean all the time. And when you go there, the hygienist actually uses a different type of instrument, not the same instrument that is used with your teeth, in order for removal of any plaque or tartar that is stuck around the implant. That way, you can prevent having peri-implantitis and prevent having the things that you saw. The other reasons as to why implants fail is what we call poor osseointegration, which is the implant doesn't actually fuse well with the bone. Now, when you don't have enough bone, sufficient bone, and the implant is placed, then the bone starts to recede because there needs to be a certain distance away from the implant in order for the implant full of bone, in order for the implant to actually stay. The third, which is incredibly important, is smoking. If you're a smoker and you're considering doing implants, I would consider cutting down the smoking or not smoking at all, or understanding that the chances of success of an implant inside your jaw with smoking decreases significantly. So, and the reason is pretty simple, is the fact that you don't have enough blood supply going to the area of the bone and in the region of the gums, and so then your immune cells, your immune system is suppressed. It's not as strong, and so you're more susceptible to getting peri-implantitis. Peri-implantitis is the main cause for dental implant failure. And the last, but certainly not least, is systemic health issues such as diabetes. It's also tied to your immune system as well. So those are the reasons. And the biggest one, like I said, the biggest one is by far is poor oral hygiene and not maintaining your dental implant properly. So if you have dental implants or you're thinking about doing dental implants, think about the commitment that is required for you to keep a dental implant. Despite the commitment, is it worth you getting dental implants? Absolutely it is, because it maintains a high standard of living, allows you to be happy, allows you to actually smile properly, to function, to chew, to socialize, to do a lot of things normally. It allows you not to lose bone structure, not to look old, to maintain your speech, and so on and so forth. It's got a lot of benefits, but you do have a different type of commitment with dental implants than you do with normal teeth. And there's a reason why you would have lost that tooth. More than likely, not always, but more than likely, it's due to periodontitis and loss of bone. And because of that, you have to be extra diligent to maintain that kind of home care and to come into the dentist every 3 months. If you have any questions regarding dental implants, feel free to message us, email us, let us know, and we will be more than happy to answer any of those questions for you. And as always, happy Friday and keep smiling.